Good morning, everyone, and thank you for joining us for the meeting of the Tulare County Board of Supervisors. We will start today's meeting with the Pledge of Allegiance. That will be followed by a moment of silence. We will be led today by Supervisor Valero.
Please join me in saluting our nation's flag. Ready? Pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. You may be seated. All right, we will start Board of Supervisors matters today with Supervisor Crocker.
Beautiful. Well, I'm pulling up my calendar. Yesterday we had a somewhat, it wasn't quite an impromptu tele-town hall, but it was one that wasn't planned far in advance that Assemblyman Mathis hosted, and I was happy to participate, and I want to thank Tim Lutz, our HHSA Director, our CAO Jason Britt, Tom Tucker, our Ag Commissioner, and Dr. Karen Hott, our Public Health Officer, for also participating on it. The purpose of the town hall was to was narrow focused, more on the agricultural community and some of the concerns that they might have if there was an outbreak that might happen at one of their facilities. What are some best practices? What are things that should be implemented? Type of employee notification, PPE questions, all of those types of things. And then I think just in addition to that, staff just shared what we're doing above and beyond that from a general census, and I think that's always good to share that type of information with the general public as far as all the good work that staff's doing every day. Yesterday also was the East Cahuilla Groundwater Sustainability Agency regular quarterly meeting, and not a whole lot of major issues going through their audits and financials along those lines. Still progressing with the annual reports. My understanding is there's a lot of GSAs that haven't quite completed the annual reports, but DWR isn't being as strict on the annual reports this year, considering COVID-19, as well as just being the first year to start submitting, especially right after the full groundwater sustainability plans were due. Let's see. Last week we also had there were a couple of calls. I know Supervisor Townsend also joined a call with Sequoia Kings Canyon National Parks. Superintendent Woody Smeck gave an update. I think they're still interested in waiting for clear guidance from us, from the county, as well as from the state as far as their opening plans. They'll be evaluating as we take different steps. But ultimately, their first phase is going to look somewhat like just opening up for day use. Still keeping public facilities closed with the exception of restrooms, but keeping the museum, keeping the visitor center closed, and that would be more or less what the first kind of phase would look like. They're also interested in opening up the wilderness areas for people to backpack. However, the caveat there is ensuring that our local healthcare facilities are able to accommodate any type of injuries. A lot of times they're more severe when there's an injury in the wilderness area, and it takes more resources to get them out. And so they want to be, they recognize that, and so they don't want to put an additional strain on our local health care if there's already a large influx being used down here on the valley floor. So that's one other interesting tidbit that they talked about, and why there was some hesitation is 60% of their traffic that they get as far as their visitation comes from Southern California. And so some of the hesitation is that if there's an opening up of the park, getting an influx from folks in Southern California, I think we all, or many of us, have seen the pictures of what happened this weekend with the Southern California beaches. And so, trying to minimize that impact. It's one thing if it's folks from within our region that are utilizing it and they're not crossing county boundaries and, still staying in a relatively close area, but it's a whole nother deal when folks are coming in from out of the area and then the needs that they have. Recognize that a day trip from Southern California that's quite a trip. So there's additional needs that are needed there. I think, and then I'm sure someone else will talk about the economic forecast, but I participated with that last Friday morning. I thought it was good just hearing some of the things that we've been reading about and other stuff. And with that, I'll conclude my remarks.
All right. We'll go to Supervisor Shucklian.
Just really been fielding a lot of calls and emails. I'm sure all of us have been with the, can I open? I should be open, and I'm going to open anyway. So we have some of that going on. I also zoomed in on the Economic Summit conference with Dr. Thornburg last week. It was quite interesting. His outlook doesn't seem as bleak as a lot of people are talking about. We'll just have to wait and see what happens there. Tulare County Economic Development Corporation meeting last week that also was quite lively. As members, they're doing a new formula, and the county will have to end up paying almost double of what we're paying right now. Well, most of the other entities will be lowering their membership, so that's something that we'll be talking about more, I'm sure, in the future. Excuse me. Yesterday we had a KTAAA meeting on blue jeans. It was a little different than Zoom. I had a little difficulty getting in on that one. And then this afternoon I will be heading over to HHSA to do another one of our board videos today on animal services and pet care during COVID-19.
Okay. Supervisor Valero.
Good morning, Tulare County. So I have a few items. One, during our Spanish town hall, and I'll say there are only 2 Spanish town halls throughout the state of California, so kudos to Tulare County. During our Spanish town hall a few weeks ago, someone inquired about a potential food distribution in Badger. As we all know, Badger is a great community, though its distance is a good drive northeast from the valley floor, and the need is great there. And so thankfully, several organizations were able to support this community through partnership. So just want to share that over 45 families were supported at this distribution on Friday. Thanks to Self-Help Enterprises, FoodLink, and Bitwise Industries for the collaboration. On the mention of Self-Help Enterprise, I'd like to offer my condolences to the Self-Help family for their loss of a member due to COVID-19. This employee worked with heart, sacrifice, and compassion to meet the needs of communities and families. Last week, school superintendents from Woodlake, Cutler, Orosi, and Monson Sultana were able to do a Q&A with our public health officer to answer any questions they had about COVID-19 and their respective school districts, and I was able to help facilitate that conversation, and it was a good discussion. Last week, I attended via Zoom the Seville and Yedem CSD meeting. They are ready to begin phase 2 of the water project. So again, kudos to the leadership at the CSD in Yedem and Seville for putting their communities first with regards to water quality and water safety. In addition to that, yesterday I also attended the brief emergency meeting for KTAAA, Agency on Aging. So thank you to all the partner agencies working diligently to support our older population with the resources needed during this time. And then I'll also be at HHSA tomorrow filming a board video topic to be determined. And then in addition to that, tonight I will be on a panel via Zoom discussing the topic, a practical response to redistribution for the MICA project and Pink House in Fresno. And so these homes are an urban discipleship ministry that place participants in a community setting while exploring urban ministry and growing in leadership development. And that is all I have for today.
Thank you, Supervisor Valero. Supervisor Townsend.
Thank you, Mr. Chair. Good morning, everybody. As several have mentioned, we've all been making these video clips with HHSA, and last week I had the chance to go over and do that, and it's always a pleasure to work with that group over there. I took a little different tack on, we've been giving so much, just good information and metrics and data out there that in talking to a lot of people, there's just a lot of, doom and gloom and things that are going on. So I tried to keep that one a little bit more positive and just talk about some of the good things that are going on. Thank some of the people that are putting in all these countless hours during this time. And I just want to give a shout out to that group, to Tammy and Mike and Chris and Noah over there that are making the videos. I took them a specific request when I went in because my wife told me, don't let them shoot that camera up your nose again because it makes your nose look too big. Now, I thought that was one of my best features, but I guess apparently not. So anyway, they really took a lot of time. I didn't mean for them to take this much time, but to raise the camera up to probably the highest it's ever been so they could shoot down on me while I was standing up. So kudos to those guys. Yeah, they had to literally take the tripod apart and put it back together.
I had to go in after, and let's just say the camera was way up here for you, and they had to adjust it down for me.
You got the
so
top
I
of
know
your
what
head
that's
on
like.
that one? Yeah, but anyway, so great job by them. And also wanted to thank Carrie and all those at the Joint Information Center for the new website, or the new, at least, web page, portal, dashboard about the COVID-19. And so it has a place, it's really easy to get all the metrics that we need. It's updated all the time. And also I had specifically asked if we could put some business help on there. And so there are links that Carrie did for me. We sat down together and kind of brainstormed what should be on there. And there are several different places to look. It's a little bit confusing, quite a bit of a maze of things that small business owners and also employees have to go through to try to find that help that they need during this time. And so thanks to Carrie and the Joint Information Center for putting that together, making it a little easier to find the information. And also thanks to Supervisor Crocker for giving info last week on the call with Woody Smeck with Sequoia Kings Canyon National Park. I got on that call and it was really interesting information. I thought it was a really good discussion, practical things that they can do to begin sort of a reopening plan, but to do it in a safe way. And so a lot of people on the call offering really good suggestions. I had a couple of questions as well, and I thank Woody as well for putting that on. Also, for the follow-up to the tree mortality and the fuels reduction funding, there was a little bit of confusion about some programs that were out there and where the monies stood and how far along we were in certain programs. And so we had, a couple of weeks ago, had a conference call, and then a lot of people have been involved in following up with that and getting that clarified. And I wanted to thank Nancy Woods and Chief Norman and Denise England, Supervisor Crocker again, Sam, for all their follow-up on that tree mortality and fuels reduction discussion. And hopefully we can, it looks like we can get some things in order where we can get some of the projects done, maybe not lose some of the funding that we were in danger of losing, and then go out there and look for some others so we can continue the good work up there. Then, as mentioned by Vice Chair Sheklian, just a lot of calls, emails, texts this last week, and now they're starting to shift to where it is talking about, well, first of all, the business help or employee help, and also potential reopening, what's going on. A lot of people they're not really sure because there is a lot of confusing information and misinformation in some cases out there about how that's working. And so just fielding a lot of calls about that to what we're going to be doing about reopening plans. This Thursday, there is the Porterville Chamber of Commerce is having a Government Affairs Committee meeting via Zoom that I will not be able to attend. I typically am there, but I've asked Carrie to sit in on that Zoom conference for me and give a little bit of updates from the county perspective. So that's coming up Thursday, and thanks, Carrie, for doing that. And that's it.
All right. Thank you very much, Supervisor Townsend. So a few things that I wanted to go over. I did participate in a Zoom call or a conference call last Friday with Secretary Mark Galey and also Director of Cal OES, Mark Gillarducci. There were the 8 chairmen from the San Joaquin Valley counties were on this call. I thought it was very productive, but it also was another reminder of how we are so similar in the San Joaquin Valley in our strategies, our situations that we're all dealing with. I thought it was a good call. They were able to hear us out and hear the advocacy for local control and also the recollection and always guiding decisions, knowing how diverse the state of California is. And not every county is an urban county or an urban center. And there are rural counties where social distancing and spacing out happens just by nature of our landscapes. And I thought that was a very good call, a good message. I hope that both the Secretary and the Director are mindful of the points that were raised as they go forward in advising the Governor as he seeks to reopen the state. Supervisor Valero mentioned self-help losing a very valuable member of their workforce to COVID-19. And I just think that makes it very real for everyone. You know, these are members of our community that are dying because of this pandemic and because of this COVID-19 illness. And, you know, so these folks that are working at self-help or you know, some of the individuals who have died are all trying to live their life and catch this illness and are unable to overcome. But the the impact that they have amongst Tulare County through the work that they do needs to be remembered as well. So thoughts and prayers out to the family at Self-Help and of the employee who passed away. And then also wanted to follow up on the KTAAA meeting yesterday. I thought that was a very productive meeting. It was actually really nice that Amy was unable to figure out the blue jeans technology. It made for a pretty smooth meeting. You know, I think it's important to remember the advocacy and the effort that goes into advocating for and helping our seniors. You know, there are so many overlooked population groups, and one of them especially is the senior population. And you know, whether it's special shopping hours, some of the retailers are creating to accommodate seniors. We've got to remember that, especially during lockdown times or restricted times, even more vulnerable are seniors and even more isolated. So the additional efforts that we can undertake as neighbors to check up on a senior neighbor we may have, or a family member or friend, let's make sure that all members of our community are alive and well and taken care of during this difficult time. So I am hopeful that we will be not only talking about, but actually reopening our lives very soon. That's all I have for today under Board of Supervisors matters, and we will now take up our untimed portion of our meeting before we get to our 9:30 timed item. I'm sorry, why am I doing that? I need to do public comment first. I skipped over that one. We'll take up public comments at this time. Public comments are available to members of the public that want to comment on any item that is within the jurisdiction of the Board of Supervisors, but not on today's agenda. Public comment can and will be limited to 3 minutes. Is there anyone here wishing to speak under the public comment period that is present in the chambers? Okay, seeing no one in the chambers. Madam Clerk, do we have any phone public comments at this time?
Not at this time.
Okay, seeing no public comments, we will close the public comment period and now take up our untimed portion of our meeting agenda. What am I doing, man? I'm just bouncing all over, yeah. I don't, yeah, wow. Item 2 on the agenda is a request to receive an update from the Health and Human Services Agency on COVID-19 status and response efforts in Tulare County. Actually, I do know why I took public comments first before this report, because I think after last week's meeting, by the time Director Lutz was done, it was like 11 o'clock. So go ahead.
I will be as brief as
No,
I
no,
can.
no. Yeah, this is a very
I
important.
thought I missed the memo of,
portion.
you didn't need to report today. All right, so starting off, and again, trying to go through this quickly, currently we're at 578 cases as of this morning. That is a 26% increase over the prior week. The prior week before that was 42%. And I highlight the percentage point because I do want to note from an epidemiological standpoint, one of the things that they look closely at is our doubling rate. So in March, our doubling rate for cases was about 5 days, 4.5 to 5 days. For April, particularly at this point, we're seeing about 15 days for a doubling rate. And what that's indicative of, again, is the stay-at-home orders having an impact on how quickly the disease is spreading. We have unfortunately seen a large increase in deaths, up 17 from last week to 35, and 614 people are being monitored and self-quarantined. Our metrics for those that have recovered is currently at 95. For our skilled nursing facilities, as was reported yesterday, unfortunately, we do have a third facility where we are seeing a cluster that's likely going to turn into an additional outbreak. That's at Linwood Gardens. As of yesterday, there were 10 residents that we had positive. I didn't see any new come in this morning. I know that there were a number of tests run, but I would expect that we'll continue to see those numbers go up. On Redwood Springs, we stand at 183 total cases. That's an increase of 8 from last week. And then Lindsay Gardens, a total of, my numbers got off for some reason. Apologies. Doing quick math here. About, 68, thank you. I don't know why my number got off, apologize, but 68 total cases. And then we did yesterday have 1 death in that facility. For Redwood Springs, there have been 24 deaths. And then talking a little bit about testing and collection sites, because that's one of the key metrics for our being able to successfully start to reopen businesses across the county. We have made some significant progress on collection sites, or at least establishing collection sites. We're able to secure 2 high-capacity state contracted collection sites. The goal is to have those sites operational by May 4th, and I say that because this is the state's vendor. The state identified a company called OptumServe. They are a contractor that serves the United States military amongst their other vendors, and they specialize in rapid deployment of vaccination or testing types of facilities. What we did then is work with the state on the metrics they use to identify certain factors for where they felt we either had testing deserts, a larger number of cases, or we had economically disadvantaged populations, or highly diverse, ethnically mixed populations, and then also the number of people that are at risk in those populations, 65 plus or chronic health conditions. We identified for the 2 sites that the state allocated the county, Dinuba at the Veterans Memorial Building, and also Porterville, tentatively also at the Veterans Memorial Building. I think it'll end up being there, but we're still working through the final details of that this week. And the nice thing with OptumServe, they will bring their own PPE, and the target for those tests is going to be 132 tests per day per each of those sites, so 264. That will be initially appointment only. There's also a good amount of coordination with public health, and that's important because that lets us identify critical infrastructure that we might need to test a large chunk of people quickly. An example would be some of our large employers in our communities where we want to try and identify potential outbreaks and have the staff come in to do the testing through this site. And then I think that was it for the testing piece. I did want to make a note, or yeah, that's good. I did want to make a note on our uptick in numbers. We do continue to see, obviously, our numbers increase as a result of the skilled nursing facilities. But I do think it's important to note we've also seen an upward trend in contact cases. And more importantly, what we're seeing a lot of are clusters with families. So, and these are families that don't live together, but that typically then are on the weekends congregating together. So we've had a number of facilities where literally you have like siblings that might work at the same job. They're socially distancing during the day at work, but then in the evenings or weekends, they're getting together. So I highlight that because it's an important point on the perception of what a household is, and our focus is it's whoever immediately resides with you is the household. It doesn't necessarily mean extended family or family that might live at a different location. So I wanted to highlight that, and we're going to be updating some of our messaging to try and better target that, recognizing that we're seeing that upward trend. And then quickly going through some of our key metrics this week, our CalMat team continues to assist at Redwood Springs and Lindsay Gardens. We'll evaluate the need at Linwood to see if we need to put some staff over there. But right now, we have 19 team members at Redwood Springs and then 7 team members at Lindsay Gardens. Also a note on PDC, I know that's been a question for us for a while. We did do a final walkthrough last week. Construction is completed. Unfortunately, when we've pressed the state for the contract of the facility operator, the state's indicating at this point there is no contract for a facility operator. So although construction has been completed and done, they are not staffed to be taking any patients at this point. What's not clear to us is if, based on the surge capacity and the fact that we haven't seen a significant surge in patients at our hospitals at this point, whether the state pulled back or whether there was a challenge with the original contract. Either way, we continue to monitor that closely, but at this point, the facility is not operational. And then for our homeless team, the Kauai Delta Street Medicine team did go out and do an outreach event last Friday at the St. John's encampment. We didn't receive any positive referrals coming back there, and they did do some testing, so that's positive at this point, but we'll be cautiously optimistic. We're going to be working with the street medicine team to provide PPE testing kits and staffing for ongoing outreach at different encampments across the county. On our business liaison, received 97 calls last week. Types of businesses that we get the majority of calls from: gyms, pet grooming, continue, and salons, barbershops, restaurants, and then golf courses and short-term rentals, lodging facilities. Our public health lab, but one of the questions that we get a lot is beyond public health's lab capacity. How many tests overall have we seen in the county? The difficulty is there's not a reporting requirement for negative test results to be reported up to us through commercial labs or hospitals. At this point, we know that there were at least 3,073 tests that have been done. And the important caveat there is we don't always get reports on the negatives, and we have to go through the state system to try and identify whether those tests were collected, but not all of them may have been put in the system. Important note that 20% of patients that are tested at Tulare County Public Health Lab have tested positive, 10% from the commercial lab facilities. So overall, the positivity of our percent of positives versus negatives is or percent of positives over the total is 16%. And as of yesterday, our total lab volume, 2,203 tests, 1,898 of those were Tulare County residents. And then trying to provide some better clarity for PPE distribution. Again, going back to the board's request last week on some context behind our PPE orders. We have been seeing an uptick in our deliveries, which is positive. It's up significantly from the lowest point that we were at, which was the 5 to 10% of our requests. At this point, our fill rate is about 45% of the requests that we put in. Last week, we were able to distribute 102,319 items of PPE. And breaking that down, the bulk of those, N95 masks of a couple different varieties, we, incident to date, have received 335,000 approximately N95 masks, and then a different variant of the N95, 110,140. Then surgical masks, 177,530. So a lot of masks, but still looking at 60 to 40% of our fulfillment requests that we're getting in from the state on those masks, although there is definitely an uptick. And then on finance, our approximate cost to date, $1,031,711. And of that, about 18,920 are extraneous overtime or comp time types of charges. Shifting gears quickly, our Human Services Operations Center has been changed. We did that to try and better encapsulate what the core focus is across the agency, recognizing that behavioral health and public health really both have a strong component there. So we're running that as the Coordinated Care Operations Center, or CCOC. And again, the goal there was just wanting to provide clarity as to what that operations center is doing, which is trying to coordinate service delivery and care outside of direct response to COVID, but more focused on the recovery and extraneous types of impacts like hunger, income, housing, things like that. And then notable piece, MDTs, we are staffing today 18 cases for inmates that are scheduled to be released from county jail. Again, the goal of trying to be proactive on knowing those releases that are occurring in May. We wanted to do those MDT teams that typically then involve probation, social workers, and other programs that that person would be utilizing. And that concludes my report for the day. I'd be a lot faster, Chairman.
No, that was great job, Tim. And you know, it's never a rush to go over all that information. There's a lot that's happening, and I think that the local transparency is absolutely critical. That we get local information. Everyone is seeing what's on the news and nationally, and reading in local papers what's happening here in the state. I think it's very important that for those that take the opportunity to tune in to our Board of Supervisors meetings to hear exactly what's happening here locally. I think that's very important, and they're hearing it, you know, straight from the source, and I think that's very, very important as well. I've got requests from Supervisor Shuckling.
Yes, thank you, Chair. Hi, Tim. Couple of things. Hate to correct you in public, but I think it's Linwood Meadows and not Linwood Gardens.
Thank you, sorry.
Yeah, just don't want people
No,
to get
I
confused.
appreciate the correction. Believe
Yeah.
me, we've unfortunately internally have made that same error, so my
No.
apologies, and I'm glad you
No,
caught it.
that's fine. And is the state now involved at Linwood Meadows like they have been at Redwood Springs and Lindsay Gardens?
Yes, so the state was out there yesterday. They did do an on-site visit. I'm waiting to get their summary back. But we have been in continual contact with the facility and the state to try and address the outbreak early, identifying from what we learned from particularly Redwood Springs on donning and offing of PPE, transfer of patient protocols, how they're isolating positive versus negative, things like that.
Are they having any staffing issues?
At this point, we haven't had significant staffing issues. They also haven't had any positive staff tests as of the numbers that I had this morning. The 10 were all residents at this point. Usually when we see staff positives is when we start to see some of the staffing issues of people calling in.
Right, okay, thank you. And then our testing capabilities, I heard there's a myth or something going on out there. What's our capability per day for testing?
We could comfortably continually sustain 80 tests per day at our
I
public
heard
health
20.
lab.
I heard somewhere that the county's always only doing 20 tests a day, and
Our-
so I just want to,
No, our capacity is 80. If staff needed to push it through, we could up that capacity. We just haven't had a need to push it because honestly, we haven't been getting as many from our collection facilities, where we always try and keep a little excess capacity for cases like Linwood Meadows. Thank you. We always try and keep some excess capacity so that we can go in and do a group of tests quickly. Hence why we kind of keep that 80 as our normal number, but we have seen a decrease in the amount of volume coming in from our collection sites.
okay. And then lastly, I think it's important to get that message out there that there are some other contact cases coming about. Unfortunately, I think a lot of people in their minds, well, they're all at the nursing homes, and so, I'm okay. And, I know yesterday we had a couple of golf courses open back up. We had a jewelry store, and I read that more are going to start opening. So, I hope that folks stay safe and we can keep our numbers low. Thanks, Tim.
Thank you. Next, Supervisor Valero.
Yes, thank you, Chairman, and thank you, Tim, for that report. So although there has been talk about reopening our economy, I'm still concerned about the status of COVID-19 and Tulare County, especially as our numbers are increasing and not decreasing. So just to make that aware. And these are some of the questions that I have today. Would it be possible to provide a hospital dashboard for Tulare County? I know Korea Delta is doing this now with its recent social media posts. However, is there any way we can get that from Sierra View Hospital and provide an overall impact report? So for example, could we list acute hospital beds, COVID-19 and availability, ICU beds, COVID-19 availability, the surge, and then also ventilators? Just because I believe that this data would provide a snapshot of the capacity of our hospitals reporting data in Tulare County.
So I will research that question for you. I will say we do, as in terms of the area response, we do track those numbers. I know that they haven't been put out there, and I need to kind of look to see if there's a concern on it. I can't think of an immediate one, but I will research it and see if we can push that out.
Awesome, thank you. Another question, would it also be possible to provide a long-term care facility dashboard for Tulare County? So this would include total cases, hospitalizations, deaths, and then separated and identified by type, so being skilled nursing, independent living, assisted living, board and care, and unknown.
That one will be a little more challenging for us because the county is not the licensing or oversight authority for those facilities. With 3 hospitals, it's a lot easier to coordinate what their beds are, and given the pandemic, they're much more interested in sharing information. We don't always have good information into some of the facilities. Obviously, the ones where we have any positive cases, we do have optics into it to some extent, but the ones that don't, we've been working hard over the last really month and a half to try and get better coordination from them. So my only hesitation would be the information we'd put out wouldn't be 100% reflective of every single bed and the status of every resident across the entire county.
Okay. Thank you for that follow-up. And then, how are asymptomatic individuals reflected in our data? And so are they being tested and quarantined, or because they don't show any immediate health risks and don't meet some of those criterias, they are not being tested? So do we know for sure in terms of the positive numbers for asymptomatic individuals?
That's a great question. Or we would surmise that there is a higher percentage when you look at serology testing that has been done in different pockets across the U.S. Certainly the numbers show that there's a larger number of people who either are completely asymptomatic or had it, thought it was the flu, have since recovered. We don't have good information locally on that at this point. And in terms of asymptomatics and testing, unless it were a facility where we were testing a large group of people, we wouldn't even necessarily know at this point.
Okay, thank you. Are we still following up with price gouging? Because I know that this was a concern earlier on, but just want to know if we're making sure businesses are not overpricing items on the market.
Locally, from our response standpoint, we don't have any enforcement mechanism on price gouging. That's a great question, actually, and I don't know that locally we've had a look into it. I know the state has looked at that closely. I know the feds have looked at that closely and tried to crack down on it.
The DA has had extensive stuff on Facebook
Okay.
and messaging regarding that and has done some investigations on it also.
Okay, the reason why I
Question
ask
is,
is because
yeah.
I did get 2 questions last week, so I just wanted to, And then what's the likelihood we're going to need additional beds and resources based on our trend lines and what our hospital census indicates? So for example, in Kern County told supervisors a state model inputted with local data showed Kern County's coronavirus peak wasn't expected to happen until October of this year, at which point cases would likely exceed local hospital capacity. That prediction is based on numbers generated by a state model that uses social distancing estimates and local hospitalization data. So do you know what that looks like for Tulare County? And does that model, state model, rely on assuming businesses and the economy would remain in their current lockdown condition through whatever month is suggested for Tulare County specifically?
I think one of the biggest challenges all of us, whether it's the health side or general public, have had during this incident is the variety of models that are being put in use. I'm not familiar with Kern's. I hadn't seen their number. I know that Quia Delta shared the model system that they use, and based on their model, they felt the peak was actually the very end of last week to this weekend. That being said, that's one model. You take a different model and it says the peak isn't until mid-May to end of May. So I think that's a really tough question. I've asked a similar question of our epidemiological folks, and we're really trying to evaluate locally what the information does mean in terms of our increases. That doubling rate that I mentioned at the beginning is one such variable that we're looking at beyond just hospital surge. But I can say, point in time today, that we haven't seen a significant uptick in the hospitalizations, and we continue to have capacity in our both acute care beds, and we're not using any of our surge beds.
Okay, thank you for that. And then just to reiterate what I had shared last week with regards to community transmission, as it's believed to be widespread throughout Tulare County, I'm still going to push for number of COVID-19 patients per city and community, as I believe this will help our local cities plan accordingly. So this is, again, just something that I think is expected or encouraged by our local elected officials in cities throughout Tulare County. And I don't know if other colleagues have gotten that same request, but at least on my end, I'm not speaking on behalf of the board, but on my end, I would encourage continued push for numbers per city. And then lastly, in a bid to save lives and not overwhelm our healthcare system, different parts of the world have chosen different measures to confront COVID-19. So at the height of Italy and Spain's outbreak, people could not leave their homes. In the UK, they can leave only for certain hours of the day due to exercise, as well as going to get groceries. In the US, obviously, activity rates by state, where Nevada, the streets of Las Vegas are empty, but yet Southern California beaches were present, as we've seen this past weekend. So, and although there are very different approaches to this pandemic, I'm still just a little frustrated about being in the in-between. Just for example, when I went out this weekend, I went to Big Lots, and Big Lots, hey, come in, go, whatever you need. But when you went to Smart and Final, masks were required. And so and obviously corporations are gonna do something differently at each of their stores. But I really just want to see a little bit more consistency for our county moving forward, just because I know that there are a lot of people out there that continue to have those questions. Hey, look, I'm putting on my mask. Others may be looking at me funny for putting on my mask, and vice versa. So I don't know. I just think that if we're going to go full force, we go full force. If not, okay. But I just, again, to reiterate, I don't like being in the in-between. So thank you.
How is that going to be enforced? I mean, if we tell everybody to put on a mask, how are we going to enforce that? We tell everybody to drive 55, they drive 65, 75. So I think it's upon, I mean, I have concerns. Also, I haven't got, you asked if any colleagues had gotten any questions regarding the cities. I haven't. I don't see what the difference is. I think every city should take it seriously and as if, they are at risk. But I think we're putting too much on our county staff and our public health officer to make mandates like that. So.
All right, Supervisor Townsend.
Okay, thank you. And Tim, thanks for the yeoman's work that you're doing on
That's
this.
my amazing
And
staff.
your staff,
so
I
thank
know.
you.
You're going to defer to them, but thank you for handling that. Do we have a number? I was trying to do some numbers the other day about the percentage of our population that was tested. Supervisor Valero had mentioned, how does the testing occur, and you explained that. Do we have a comparison to other neighboring counties of the percentage of their population that has been tested? It looks like ours is like maybe 0.4%-ish.
Mm-hmm. That's a really good question, because if you take what we estimate on the 3,078 and look at our population, that's the percentage you get. I haven't seen a consistent comparison across counties, and I think because a lot of counties are grappling with that same challenge we are of, we want to see enhanced testing. That's great that the commercial labs are online, but we also lose some optics into how many actual tests are being done by the collection sites. So last week, the board had asked about, can we list out the collection sites? The challenge was we were even trying to corral all of the different sites across the county. So it does speak to, with things moving as quickly as they are, the challenge that we've had of maintaining optics into all of these different collection sites. So I will do some research and see if I can get you a better answer on that comparison. Today I don't.
Okay, well, and thank you for that. It's not nearly as important as all the other work that you're doing. Really, it's a statistic. The only reason I'm bringing it up is all of the chatter you get about how many cases, because everybody's looking at number of cases. But obviously, if you don't test, you have 0 cases. So we could not test and have a way lower cases, but I think that we've been doing a great job of testing from day one because we were up and ready to go. And I just wondered how that compared, because especially with the governor's plan, really general plan, that testing is such a big part of it, and sort of knowing where we stand, I think is going to be a big part as we go on the next several weeks down the road. So, like I say, not nearly as important as the work that you're actually doing to to take care of people, but just something to know for planning purposes.
Well, and you're absolutely right there. That was kind of one of our observations early on when we were ahead, is knowing that we were trying to be aggressive on testing. We could leverage our public health lab and get those tests back quickly. That definitely factored into, I think, our early jump. It has been sustained, but with the skilled nursing facility outbreaks, that accounts for a huge amount of our increases. We're trying to factor out those outbreaks to try and look at us more, apples to apples type of comparison, and I think we're getting close to feeling comfortable with some of that data to start to push that out too.
Good, that's great. That was actually a follow-up, so thank you for that. Yeah, thanks, Tim.
All right, Supervisor Crocker?
Thank you, and again, appreciate the update, Tim. It's always very informative as we learn more and hear about all the good work that you and your staff are doing. Specifically on Linwood Meadows, I know with Lindsay Gardens we were able to test everyone there. Is there a plan to do that, or have we already begun to do something similar at Linwood Meadows, and what does that process look like?
Yes, we were having that conversation with the facility administration yesterday. They are completely on board with testing everybody. The challenge we have going back to, we tested everybody at Redwood Springs, but then still see those increases. What it does tell us, though, at least, is if it's continuing to spread in that facility, and then to try and identify where. With Redwood Springs, for instance, looking at staff and their PPE use and their protocols. So we are doing that. We want to test both residents and staff at the facility.
Thank you.
Okay, thank you very much. And again, Tim, I want to reiterate the kudos to your staff. I know that this continues to be very demanding of your public health staff and media staff and just general staff and you. So really do appreciate the work that everybody is putting in. They truly are prioritizing this and making sure that information gets out and that we really are there for our population and our residents, and that's very much appreciated. Please do convey the words of positivity and encouragement to your staff, because I know it's easy to get down during this time, especially with so much doom and gloom around us all the time. But please do pass on positive compliments and thank yous from this board.
I will. Thank you.
Thank you. Much appreciated. All right. Now we will move on to our timed items. Our 9:30 item number 4 is a request. It's a public hearing. It is a request from the Ag Commissioner Sealer to consider proposed fee changes. I will open the public hearing and call up Mr. Tom Tucker.
Good morning, Tom Tucker, Ag Commissioner Sealer, Chairman Vanderpool. Good morning, Supervisors, Mr. Britt and Ms. Peterson. Good to be here. As every year, as required, we take a look at our fees that we charge and make sure and determine that we're not overcharging or undercharging for that matter, just to keep everything going on a cover the cost basis. So with that, we did that very thing, and we do have a few fees to both increase and one to decrease, and we will take a look at that now, if I may proceed.
Please.
Starting off with our phytosanitary inspections, which are required for most of our state, federal, and export shipments. We have two main ones. We have a regular phyto, we call it. You can see the count there and our cost of $51. We have a current fee of $55. And in this case, this is the one that I'm proposing and asking for a decrease. So I would like to decrease the fee from 55 down to 51, which is an 8% decrease. So as these fees, the cost for us to implement the services, the certifications, the certificates, either increase or decrease, we act appropriately. The high intensity is for those countries that require a higher level of inspection, more fruit inspected, whatever the case may be. So we had 12,824 of those at a cost of $89 for a certificate, which is for an entire shipment, a load, a container. It varies quite often. Our current fee for those is $80, but we do need $89 to stay at cost recovery for that. And that does come out to be a 10% increase. On the bottom of the screen, you'll see the noted increases and decreases will result in a $39,248 increase in net county cost recovery. We also have hourly inspections, which are miscellaneous in nature, but to break them out, we have other services at a cost of $51.50 per hour, and we have a current fee or charge of $46. So I'm asking and proposing that fee be increased.
Tom, can we maybe change that number to like $51.49? $51.50 is kind of got associations with that terminology. So maybe $51.49 or $51.51.
I'm certainly willing to go either way.
All right.
To your pleasure.
I'm kidding. Go ahead.
Okay. That does come out as a 12.5% increase. These are upon request, these type of fees, and they're voluntary HLB sampling of nursery stock, for an example. This is considered a WAHR, or a weighted average hourly rate. The next one is our nursery, which is a new fee in this particular type. I'm asking for the same $51.50, an hourly rate. And because it's new, I don't really have any basis, so I think it appropriate to ask that it be $51.50. Industrial hemp, weighted average hourly rate, I'm asking that to be effective at $428.20. If this board decides to move ahead with this proposal, then that particular one would become effective today. As we know, in May 7th, I believe, our current industrial hemp moratorium is going to relax, abide, and we will be able to start accepting fees and registrations at that point for industrial hemp. The noted increases will result in a zero net county cost, absolute cost recovered for hourly services provided. So no profits, just cover our costs. Switching over to our weights and measures inspections, we have electric submeters, and in 2019 we did 276 of those at a cost of $5 per meter. The current fee is $2, and I'm asking for $3, which is a 33% increase. The reason, let me finish up here. Electric submeters are capped by law at $3 per device, where the others, the vapor sub meters, are capped at $4 per device. and that's the next line down, where our current fee is $2 for vapor meters, and I'm asking for $4, with the cost actually at $14. These increases are coming from a increase in the amount allowed in law. I think it was less than 2 years ago, the law was changed to allow for these. Last year, I did not have these broken out so I could bring you accurate numbers as far as electric meters, vapor meters, and others, because they were all lumped together in the code, and that's the way we track them as well. So with all that said, we are still well below cost, but we are asking for the maximum that we can. The new one, third one on the list here, is the electric vehicle supply equipment, which is used to test commercial vehicle chargers. And that fee category is $21 in the code. We have not done any of these yet. We propose to do some this coming year. There are a few of these chargers being installed in our county, very few at this point, but we suspect that that will just continue to grow. And as it does, we will have more information on the actual costs to bring back to you. But from our experience, $20 will certainly be, would not likely cover the costs, unfortunately. The noted increases will result in $756 increase in cost recovery. I contacted the following for a response. We sent out 192 postcards that were sent out to every entity that has recently applied for a phytosanitary certification or submitted a registration for an electrical submeter or a vapor submeter with our department. These are the bulk of the packing, marketing facilities throughout Tulare County and mobile home establishments for the devices. The Tulare County Farm Bureau was included as well. 17 inquiries were made asking for a copy of the proposed fees, just asking for information. And if there were any additional comments or requests for comment, we would answer those. The commissioner and/or the assistant spoke directly with 25 individuals at a Farm Bureau meeting and many more at Tulare City Government Affairs meeting. There were no questions beyond simple clarifications. For our neighboring county comparisons, Fresno, Kings, Kern counties all charged with a weighted average hourly rate, with a couple charging a certificate fee also between $18.50 and $40. Tulare is asking to charge a set fee of $51 for regular phyto inspections and $89 for the high-intensity inspections or certifications. For comparison, our high-intensity inspections average 1 3/4 hours to complete the inspection. And we would be charging $89 for that completed inspection with the new proposed fees. Our neighbor to the north would charge $160 for the same inspection with their posted fees and rates. Now, there are other counties that will charge a little less than that, but they're all more than what we plan to charge. Our hourly charges are based on the individual county's pay level. We use productive rates that include overhead, benefits, and accrual costs. Weights and measures fees are all capped by state law. The new fees for hemp and EVSE are based on a weighted average hourly rate for cost recovery purposes, which is the same in other counties, but in relation to their own pay levels. And that brings me to the end of my presentation. Are there questions?
Just a quick compliment, Tom. I know going back a few ag commissioners, when Gary Kunkel would come to the board with proposed fee increases, there were some that were 800% increases and different things, and the only justification was because we haven't done it for 10 years, 20 years. And I'm glad that we are no longer doing that. I think it's important to look at our fees on a regular basis to make sure that we are recovering costs, and in the cases where we're able to decrease the fees to accurately reflect our costs of doing business, as we do gain efficiencies in some of our various practices. One thing I thought that was very beneficial too was your inclusion of number of inspections and what the fee changes would do in terms of overall cost attributed to your department or revenue gain based on the number of inspections. I thought that was very good. And I also appreciate your comparison to neighboring counties. We always want to make sure that we are competitive and hopefully in most cases more efficient in doing business better than our neighbors. So thank you very much. I appreciate it. Any additional comments or questions from board members before we open up for members of the public?
Is that Kyler's name up there? Is that from before?
That was from before.
No, I just, I want to commend you also. I see that, with sending out the postcards and doing a lot of outreach and response also. So I'm supportive of this.
Okay. Are there any public comments? This is a public hearing. Madam Clerk, do we have any phone comments?
No, none right now.
Okay. With that, I will close the public hearing and bring it back to the board for action.
I would move approval.
We have a motion by Supervisor Shucklian and a second by Supervisor Valero. He's learning to press the button quickly. Good job, Eddie. Everyone please vote. All right. Motion passes 5-0 unanimously. Thank you very much, Tom. Appreciate it. Have a great day. Item 5 on our agenda is a request from the Resource Management Agency to consider proposed fee adjustments as listed in Attachment A and Attachment B, and also a request to approve the proposed fees which are listed in Attachment C. This is a public hearing. I will open it this time. Sherman, how are you?
Good. How are you all?
Good.
Good morning, Supervisors,
Grub in.
Chairman, CAO. Before you today, our annual fee update. We are coming to you with a couple fee requests. On the proposed fees before you today, one is a planning fee and one is for our roads division. The planning fee is the remaining year. We had a multi-year fee increase that was implemented back in 2016. This is the final year of that. So we're not really asking, it was prior approved. We've asked for you to reapprove it every year. This is the final year of that increase. And we have an analysis on that to justify, that's why we looked at it every year, to justify its continued increase. And then proposal for the road divisions is a fee to recover some of the costs related to processing special events within the county. For the planning fees, we have roughly 201 separate fees on in our planning division. Those had been reduced in last year when we went through an overhaul of our planning fees. There's no new requests this year for fee increases, like I explained earlier. Only fee increase is our setback variance, and the total individual fee increase is $90. Setback variance, just as a refresher on what that is, property, when they're building on a property, there's certain requirements to respect the distance between buildings, known as a setback. If those are established through our zoning code, if a property owner wants a variance on that, meaning they're allowed to go beyond that setback, they would request a setback variance, and that's what this fee is for. So we did a survey again of this same fee, 8 counties: Kern, Kings, Fresno, Tulare, Madera, Merced, Stanislaus, San Joaquin, and Tuolumne. We also compared 3 years of our fee history and our costs. So at RMA, we track everything by project, so it's easy for us to identify exactly the cost specifically spent on this particular fee when it is requested by a constituent. And so the results are, currently the rate is, for this fee is, for the service is $1,260. We're asking it to be increased to $1,350. The 8-county average for this service is $2,030, and the average cost for RMA to provide this service is $2,796. So our cost recovery is 48%. We have, our annual average cases is 2, so the increase of $90 is going to bring a whopping $180 more to RMA, but it's important for us to collect as much cost recovery as possible. You can see the 48% is quite a low rate of recovery. For our road division fees, this has been something we've looked at for a couple years, so we implemented the same process on the road side. We started tracking the cost of our special events and the time that was used to process those requests. These would be your races, bike races, even some of the waterway events that take place. RMA handles that review. Some of the things that are done during that review would be street closure, detour plans, traffic control plans, approving insurance documents, and then bringing that, preparing an agenda item and bringing it to the board for approval. There's currently no fee. Staff cost average over $1,000 per event. That was based on 24 events over the last couple of years. We surveyed fees from the following agencies: Kern County, Kings County, Fresno County, City of Visalia, City of Fresno, and Stanislaus County to compare to. We also, like I said, compared our last 2 years of costs and our average per event. And we're suggesting a fee of $200, so currently obviously no fee. The 6th agency average rate was $220. Our average cost of service is $1,103, so it'd be an 18% cost recovery. We're not recommending anything higher simply based on the 6th agency rate. I mean, we want to be competitive.
Absolutely.
So this was our fee agenda item. Was reviewed by county council and approved, reviewed by the county auditor. Our method was approved, and we publicly noticed it. We also sent out letters to interested parties related to these fees. So with that, I request that we approve the proposed fees for Tulare County Resource Management Agency effective July 1st, 2020, that are listed in attachment C of the agenda item.
Right, any questions or comments from board members? Supervisor Crocker?
Thank you, Sherman, for the presentation. I just want to emphasize the point on the new fee for special events. I know that you stated that you're not looking to make that any more in the future, but I want to emphasize that I think that's, it doesn't happen that often based on the numbers. The special events are fairly infrequent. And so even though there's a low cost recovery, that the overall dollar amount is fairly minimal to the department. And I think that as we look at the handful of, parades and race events that may happen in unincorporated communities and out in the countryside, that there are often nonprofits and schools that are doing this, and that could be a burden if it's more than the $200. I'm supportive of the $200, but just want to make sure that we're looking at that. Also, I know in looking back at what the process was to hold a parade in Strathmore for the state championship football team, that one of the actions or one of the part of the process was that the full board had to take action for road closures, and so I would suggest that we work on that process to allow for director approval for some of those things, and I think that should decrease some of the cost, so that we're decreasing costs where you don't have to go through a full agenda review, or if you wanted to have CAO, approval, something along the lines where staff could make that approval. I don't think that it's necessary for those type of things. that are really fairly minimal, that are regular occurring, and so I think that would be good to reduce your cost to be able to provide that, so increasing our percentage without increasing the fee.
I think those are great recommendations. A delegation of authority to the CAO would probably make a lot of sense. I do know that some locales also delineate between nonprofits.
Yeah.
I mean, majority of these are going to be nonprofit, I guess, but maybe not so. Delineate between nonprofit and for-profit and charge, it could be zero for nonprofits and a fee for profits, for a for-profit entity.
Okay. Supervisor Valero?
Yeah, and good comment, colleague. And I just wanted to kind of share with the public, because sometimes the individuals don't understand that Tulare County is a cost recovery agency. It's not a profit-making entity. And so I've had many kind of responses due to COVID-19 with all of the kind of the late fees and such, and I keep on reiterating, we are a cost recovery agency, not a profit-making. So just wanted to share that as well.
Thank you.
Okay. This is a public hearing. Are there any members of the public who are present or on the phone wishing to comment on these fees, Madam Clerk?
We do not have any on the phone.
Okay, I'll bring it back to the board. We'll close the public hearing and bring it back to the board for action. We have a motion by Supervisor Crocker, a second by Supervisor Shucklian. Please vote. Motion passes 5-0 unanimously. Thank you for the presentation. We will now take up our consent calendar, items 6 through 20. Are there any items that board members or members of the public would wish to pull for separate consideration or correction? Supervisor Crocker?
I'd like to pull item 7 for separate consideration.
Okay, item 7 will be pulled for separate consideration. Anything in addition, board members, members of the public? Madam Clerk, do we have any comments?
We do not.
Okay, seeing none, Chair will entertain a motion for the balance of consent. Ooh, quick on that button. Good job, Dennis. We had a motion by Supervisor Townsend, a second by even quicker than Amy, Supervisor Valero. Please vote. Motion passes unanimously, and I will now take up item 7. Supervisor Crocker.
Yeah, I'm supportive of this letter. I do have a question as far as for the board's consideration or request. Since this is specifically talking about an upcoming federal response package, should we be including an ask for infrastructure dollars as well? That's something that follows along with our federal policy platform. There has been discussion about a possible infrastructure being a part of the ability to jumpstart the economy. And I'm thinking, the areas that have been talked about specifically in some of the early discussions have been broadband, water projects, and transportation. And I don't know that I also don't want to necessarily muddy the waters because this is specifically for local government assistance, but I also think that it's important that if we're making the ask, then we also say, this is important, but we also have these other asks as well. And so I would like it, I don't think it would need to be lengthy, but have a paragraph or something that also states that we're supportive of having infrastructure included and touch on those 3 broad areas.
We could add a paragraph, or even, since it's within the policy platform, a separate letter that wouldn't be a overly burdensome process.
That's all I had.
Okay.
And good morning. Sorry to interrupt. I hope you can hear me. This is Samantha Ferrer, Board Representative. I am calling in for this item and taking notes, so we can add that paragraph if the board chooses.
It's as if you're here, Sam. Thank you for those
comments. Oh, good. Thank you.
All right. Anything further from board members? Chair will entertain a motion then.
Move to approve.
Have a motion by Supervisor Crocker, second by Supervisor Townsend. Please vote. Motion passes 5-0 unanimously. We will move on now to our untimed portion of our meeting. Take up item 21, which is a request from the Resource Management Agency to approve the 2020-2021 County Transportation Improvement Program.
Morning.
Good morning, Reed.
Reed Shanky with the Resource Management Agency. I'm happy to be with you in person today. I've been doing so many Zoom meetings I had to...
Yeah, you've got the soothing Zoom voice
Yes,
going on.
I had to remind myself to put on pants today. Yep. Real briefly, before I get into the CTIP itself, I wanted to give a quick update on operations at RMA in light of the COVID issues. Office, field staff, we're working. Microphone, speak into it. Didn't want to get too close there with the transmission.
We might have a mask if you need one.
Yeah, thank you. Office staff is primarily working remotely. Within about 2 days after the governor made the suggestion to basically shelter in place, we switched about 95% of our staff over to a remote workforce. I really want to thank staff for being willing to do that and stepping up and taking the extra efforts required to do so. We actually managed to remain pretty productive. There's probably a little bit of a loss of productivity, but overall I've been very impressed, and my concerns have not been founded that we would be losing a lot of time here, so happy to report that. The field crews, we have the 4 distinct road yards. We've created kind of a firewall so that they're not mixing between them, so that if one crew goes out, we don't lose all of our county forces. And within those crews themselves, we've reduced staffs down, and they're working in shifts, so that if one does go out, then we're able to maintain the operations there. We're continuing to do business in the permit center. We're going by appointment only, doing 5 appointments a day, but the majority of the workflow coming through there, the applications coming through there, are either through the mail or through electronic means. So it's something we've been working towards for a while, but this really just pushed us forward and kind of forced our hand there, and it's actually working out real well. So maybe one of the hidden silver linings associated with this. Related to transit, we expect to be going to fare free with TCAT starting May 1st. There's a couple of reasons we're doing that. It's kind of following suit with the cities that have already gone there. The cities serve as our primary retail outlet to sell passes, so with them closing up their fare side of things, we're almost forced to follow suit, but it does have the added benefit of reducing transmission and potential for the disease to be passed. As it relates to funding, the federal government through the CARES Act is providing a significant amount of funding for transit that would be able to well offset any of those revenue losses related to the fare box there. So again, starting May 1st, and that'll go until it's deemed unnecessary there. So with that, I'll get into the County Transportation Improvement Program.
And real quick, before you leave that subject,
Sure.
Reed, what are we doing to advertise the non-fare climate that we're in? I mean, I would think that would be something that we would publicize as much as we can, especially seeing as we're being reimbursed from the feds to cover our costs. I think that there are a lot of folks in isolated or very, very rural Tulare County that could benefit from transit availability to get to marketplaces or centers of commerce. So I just throw that out there.
Absolutely. We can get back to you on that, but it is being posted on the website. It's being posted on the buses at all the stops, that sort of thing. So
Thank you.
yeah, it can be seen as an opportunity to kind of increase our transit usage out there. It's a bit of a marketing opportunity. So unless there's other questions about general RMA operations, get into the County Transportation Improvement Program.
I have one more real
Sure.
quick about the buses. So, and we're taking precautions for sanitizing and wiping down rails and seats and all that.
Absolutely, yeah. We've hired additional crews, cleaning crews that specialize in this sort of thing. Our buses are smaller generally, so we don't have quite the issue that some of the larger city-type buses do, where the passengers are walking right past the drivers. Think of our buses more like the rental car shuttle, where the driver's actually sitting in a separate seat, so there's a little bit of more isolation there. We have blocked off seating so that there's as much spacing as possible, but yes. Quick overview of the presentation here. I'll touch on what a CTIP, or the County Transportation Improvement Program, is. I always like to take the opportunity to talk roads funding, particularly in this light, some of the impacts as it relates to the COVID-19 situation, and how that will affect our road fund balance or our reserves. I'll run through or highlight some of the items, the projects that are in the 1920 County Transportation Improvement Program. That's actually a typo. This is the 2021. So on background, the CTIP identifies the RMA's improvement and maintenance strategy, primarily focusing on what I'll call the projects related to road maintenance and improvements. It's the 4th year that we've been doing this. Not all these projects will be constructed in 2021, but may be completed in later years. The key identifying factor is that they will all be initiated here in 2021. The general operations and maintenance of road maintenance isn't typically included in the CTIP, so things like our general pothole repairs, shoulder clearing, sign maintenance, that sort of thing, that falls in kind of just our general operational budget. With enough roads to drive from here to Connecticut almost, there's lots of areas of need. It's not hard to find a place to spend the money, but the challenge really is allocating the resources that we do have. So we kind of use a broad range of tools from the quantitative, the analytical side, down through community plans and input to the more qualitative side. Things like we want to be able to be responsive to the public requests that we know both you get and we get directly. This chart here, this slide, shows our projected funding for fiscal year 2021. This is our overall roads budget, not just the budget related to the CTIP, but the CTIP does utilize the majority of these different funding sources. So a couple things to point out here is you obviously see the 3 large pieces of pie there, the HUDA, the SB1, and the Measure Our Local programs. These are all directly related to either sales tax or sales of gasoline. They account for over 60% of our general road fund revenues, and there's a big question right now in how those are going to be impacted. Obviously, with people sheltering in place, they're driving much less, they're buying less gas. The good thing on the HUDA and SB1 side is that those, as of SB1's passage, are cents per gallon rather than a percentage per gallon. So with gas prices going down, we're not going to see that dramatic an impact, but with people driving less, it will be reduced substantially. Measure R obviously is a general sales tax revenue, so that's a little bit closer to home. We'll see coming up here in the next few weeks or so, once the reports start coming out, what that impact is, but I'm certain there will be a reduction as related to sales tax. One other thing to point out here is on the LTF, the local transportation funds. Those are excess funds that initially go to transit. The unspent money then gets dropped down into roads. We also have federal funds, some other miscellaneous state funds, services to other departments on there. So a total expected or projected budget of a bit over $66 million for 2021, but I do suspect that that'll be reduced in light of the COVID-19. With that, we haven't seen any particular projections related to those reductions. CSAC, or SEAC through CSAC, is one of the primary sources that we get those projections annually. We expect that those will be coming out in early May here as they relate to the SB1 and the HUDA funding. So that'll give us an idea of the magnitude and the reduction of the COVID-19 impacts. With this CTIP, we're assuming a 0% reduction. We want to kind of aim big and then be able to scale back as possible. So a lot of the projects are being designed so that we can reduce them in scope. And as we get better information about what those revenue reductions will be, we'll come back to your board to be able to kind of delineate or identify which projects we would see a need to reduce. One potential upside, though, is oil prices are very low right now. A lot of our road rehab projects are almost entirely cost-driven by the cost of oil or the asphalt that goes into it. So if those prices stay low, then we will be able to get a pretty good bang for our buck. And maybe similarly, if the market is hungry, if there isn't that much work out there, then contractors will be a little bit more likely to give us some good bids on the projects. This chart gets into our road fund reserves or our road fund balance. Just briefly describe what we're looking at here. The yellow line is our total road fund balance, or what call it the cash reserves, what have you. Up until 2017, 2018, that was kind of all we really tracked. Starting in 2017-18, we began doing these C-tips. As I said, this is the 4th year we've been doing that. So now we're tracking both the total fund balance, but also the uncommitted reserves, which is really the amount that's discretionary and available for us to work with. So that's the blue line there. A couple of the key points throughout the timeline, 2009, Obama-era Stimulus Act, brought that forward, spent that primarily on road rehabilitation projects. 2011, AB 720 was passed. That's that's a state bill that limits the amount of work that our road crews can do with that we can do with county forces as a percentage of the overall costs that we do. So this was intended to push a lot of the spending to the contractors, to the private side. There are some benefits to that as far as purchasing of options and opportunities. So mixed bag there, but it did limit the amount of work that we could do ourselves. 2017, the board authorized an advance of $5 million. We're calling that our Farm to Market 1.0. That was measure our revenue that we move forward. Those projects have all been completed. SB 1 was also passed in 2017. You're familiar with that, but almost immediately thereafter, a referendum in place to pause that. So we really didn't get to spend that money until a bit later. We're now looking at a Farm to Market 2.0. This is the $10 million advance from TCAG Measure R that's going forward. Your board's already selected and identified those projects and authorized us to move forward with that. So that's kind of that peak there. But the general trend post-CTIP world, I'll call it, is that we've been moving the needle downward, trying to spend the money. We don't want to sit on a large amount of fund reserves. We want to get it out on the streets, literally. The end result is our projection for the end of this fiscal year 19-20 is almost $18 million of uncommitted fund balance. That's that bottom of the blue line there. Then projecting a little bit further, this is where we get into the crystal ball gazing, is what's our fund balance going to be post-COVID impacts. So that's this next slide here. The yellow line at the bottom is our fund balance at the end of the fiscal year. Like I said, a little under 18 million for fiscal year 19-20. And then we've got 3 cases, and these are really guesses at this point. If I had to put money, I'd say it'd be in that middle case, somewhere around there. But we've got a 0% revenue reduction, a 15% revenue reduction, and a 25% revenue reduction. And you can see, and that's really the HUDA, the SB1, and the Measure R revenue that we're expecting to see a reduction on. If the CTIP, as proposed today, we go forward with in the full amounts, then you can see with those revenue reductions where our fund balance will sit. So we're ranging from 14.2 million to 6.2 million. So it can be a pretty dramatic swing, and that's how much we rely on those revenues from primarily gas tax sales. We do, being prudent fiscal managers, we do want to make sure we have some form of a reserve savings. We don't have a formal policy in place, but we're kind of evolving towards that, and look forward to future discussion and direction with your board on that. There's 3 primary sources or reasons to save the money, and then a 4th, which is a little bit more discretionary. Going through them, we've got the rainy day fund. GFOA suggests about 3 months of operating expenses. That works out to about $5.5 million in reserve funds. Many of our projects are reimbursement based, so for cash flow purposes, we need to spend the money before we can get it back. So we would like to, or we suggest retaining 3.5 million. That's based on prior 3 years of average, average of needs. And then we do have a large number of capital assets that are nearing end of life, so we've got to save some reserves to be able to replace that. So at this point, you add those three up, you get that total $10 million of suggested amount. Reiterating that the roads fund is treated as a quasi-enterprise fund. It's separate from the general fund at this point, so we're kind of self-preserving here this independent amount of money. The fourth item there is savings account for future unfunded priority projects. Like I say, this is a bit more discretionary, and the question is how much do we reserve? There's plenty of need out there. The board could easily direct us to spend it and go. But we've seen in the past that there are projects that we just don't expect to come up, and we like to be able to support them. A couple examples would be the Avenue 280 Caldwell interchange. We're able to work with TCAG to advance that by putting in $1.5 million on the design side, so that moved the needle forward there. Another example is the collaboration with the Thule Reservation on the casino relocation. So just having some money for unknowns out there is important. Getting into the CTIP itself, I won't read all through the projects, but I do want to point out that in this list, we're also identifying the RRAA, which are the Road Rehabilitation, or Road Repair Accountability Act projects, which is SB1 money. The next item on your board's agenda is the actual formal identification of those projects, but they're listed here. You can see in the project description, the parentheses, we call them out as the SB1 projects. So real quickly here in District 1, a couple highlights. Designing the Caldwell widening, phases 2 and possibly phase 3, funding dependent. This is the stretch between Visalia and ultimately to Exeter. We're recommending rehabs on roads 204, Avenue 272, Road 168, and Avenue 256, just to name a few. In District 2, large portion of these are farm to market 2.0 projects that have been previously approved in that 10 million advance that we mentioned. But we're also looking at the Early Mart Sidewalks project, which is a $2 million ATP project. Just last week was approved by the CTC for state funding, so very excited about that. Road rehabs on Avenue 184, Avenue 216, which is Page Avenue, and Diagonal 112, which is I Street. In District 3, obviously fewer roads, county roads within the district, but no less important here. We're looking at some blade patches in some of the county islands, which may have the result of kind of the good planning practice of getting some of those county islands annexed. A good example is there was a county island on K Street that 2 years back we paved and did some maintenance, and that helped with the city's push to actually annex that small portion. So moving forward with that, and then rehab on Avenue 320. District 4, we are looking at, there's a large number of bridge projects coming up in District 4. We've got 5 in various stages of design, right-of-way acquisition or construction. We're also looking at rehabs on Avenue 416 and Road 168 as a couple examples. And in District 5, we're looking at some work on Teapot Dome. I mentioned the Thule Reservation relocation coming there, so we're watching that closely, make sure that we can get that done before their casino's built. We're looking at rehabs on Road 208, Avenue 160, Diagonal 238, and maybe kind of something interesting here is on Avenue 152, the bridge over the Thule River, which is probably one of our second largest bridges in the county. We're at the top of Caltrans' replacement list for that one, so we're starting the project to repair or to actually replace that. That's about a $10 million bridge replacement project. A number of the projects on the CTIP are countywide projects, so not district specific. You can see them here. I won't list them all, but obviously the chip seal program is a big one. We've got our $1 million reserved for rapid response. These are for repairs that come up throughout the year that we didn't see in our crystal ball, but that come up, so we want to be able to be responsive to that. So as your board gets those requests, we want to be able to get out there and show that we're hearing that. We've got $750,000 programmed for ADA improvement programs. We have an ADA transition plan, which identified a large number of curb ramps that are not up to ADA standard, that sort of thing. As long as we're making progress in accordance with that transition plan, then that provides us liability relief for potential lawsuits against ADA issues there. So we want to make sure that we're making an effort on that front as well. Slurry seal program is new. We're going to try that out. In place of chip seal, there are certain locations that make a better use of a slurry seal. That's a sand with oil, basically, so it gives it the similar but not as effective rehabilitation treatment as the chip seal, but it works better in areas with curb and gutter, more neighborhood type areas. And then we're starting our bridge preventative maintenance program too. So between the two programs, a bit over $1 million there for bridge repairs and replacements. That's all federally funded. I mentioned that the CTIP also includes the Road Repair and Accountability Act projects. These projects, we've got about $12.7 million worth of work identified. Maybe slightly less due to the COVID impacts, but I can talk about that a little bit more in that next agenda item. And then a couple of accomplishments. These aren't necessarily highlights or the most important projects, but they represent kind of the broad slate of projects that we do or that are included in the CTIP. So here's a sidewalk project in Traver, some new sidewalk, and then we were able to get the roadway repaired there. This is a ATP project leading to the school there in Traver. Early Mart Sidewalks project. So a lot of work going on in Early Mart as part of the park project. It left a need for sidewalk along the street there around the park, so we were able to get that one. Another ATP project, or ATP program project. These ATP projects are probably about 3 to 4 years behind where they're applied for, just the way that the funding cycle works out. So you may see applications go in, and then they kind of get lost for a while, but just want to emphasize that they do get done once that funding becomes available. We completed the Bear Creek Road over Rancheria Creek Bridge replacement project. It's got a number of different names, but I think that's the one we settled on by the time we finally finished the bridge itself. You can see a nice picture of the bridge there. It's up just up the hill past Sycon a little ways. And road rehab projects don't create the sexiest of pictures, so I don't have too many, but we did do quite a few miles here. Here's one of them, nice black asphalt. Community accessibility enhancement project. These have big bang for the bucks. They're new sidewalks, flashing beacons, ADA ramps, that sort of thing. So that was one that we completed here recently with Measure R funding. Liked that one, so included it twice. So with that, happy to entertain any discussion or answer any questions that you may have.
Reed, just a great presentation. I think that we're definitely seeing the improvement in the county roadways, thanks to all the various funding sources, but there still is a tremendous need out there, and I think that we have to be mindful of that. And there's a lot of uncertainty right now with the restricted driving, refueling, revenues coming down across governments. So we have to be very mindful in how we spend the reserve, the road fund. I do want to spend it down, that is appropriate over time, but especially given the uncertainty that we're seeing right now, I want to make sure that we're able to continue with road rehabilitation going forward, even if revenue does decline that we depend upon coming in from the state or federal government. So I think that's important to be mindful and prudent in our use and spend down of that reserve. But great to see the project. I think there's going to be a lot of really good work done as long as we are able to carry out the CTIP as proposed this year. Supervisor Crocker.
Thank you, Mr. Chair, and thank you, Reed, for the presentation. I have to say that this is probably the most transparent presentation I've seen as far as the roads reserve, so I appreciate the discussion as far as where we're at, what funds are already allocated. Some logical thought process as far as where we should be from reserve. So I'm very supportive of getting monies out, as I've stated in the past, but also supportive of the plan that was presented today, as far as a future to still maintain some reserves, recognizing we need cash flow, recognizing that we want to be able to be flexible and take advantage of other dollars, of state and federal dollars become available. So I think that's a very wise and prudent approach, and I really appreciate the fact that we're focusing on getting money out on the roads itself, that we're not holding back. I know that that was more or less a practice in years past, but we all recognize there's a huge need, and so being as prudent as possible by getting as much money out is the direction that I'm supportive of. So thank you.
All right, Supervisor Townsend?
Thank you. Thanks, Reed, for the update, and it's looking good. I just want to share real quick, as you started off with some of your operations, that I've been getting some good feedback on how it's been going with RMA, pulling permits and things like that, even though you have a lot of the workforce working from home, that they've been able to, people have been seeing permits turned around pretty quickly, so that was a pleasant surprise to hear that it's going well, even operating under those circumstances, so great job on that. And also on your advanced planning with the crews, keeping them separated, getting the rotations going, and still being out there maintaining the work, I think is great. And on the road fund balance projections, same as Supervisor Crocker, appreciate seeing the options and what you're thinking about. I know when we talked about it, I don't know, a month or so, 2 months ago maybe, at this point in time, we talked about what we could do to get more money out on the roads. The thought was to go ahead and allow that fund balance to be spent down a little bit to a certain level, and we were kicking around that $10 million, which would correspond with the 15% revenue reduction. At the time, of course, we were wanting to put more money towards the roads and take advantage, get some things done before the roads got into any worse state of disrepair. Now we're having to maybe backfill what we're going to be losing because of the various taxes revenues going away. So, but in any case, I think it still points to the fact that we should probably keep something around 10 million in that reserve, which is where you're headed, and probably do that on a regular basis. So if we have it in there, we can spend it on getting it on the roads, or when we need it for cases like this. So thanks for the update. Great planning. Good job.
Okay, anything further from board members? This is a request for approval. Any public comments from members of the audience or calls in, Madam Clerk? Okay, seeing none, Chair will entertain a motion.
Move to approve.
All right, I have a motion by Supervisor Crocker, second by Supervisor Valero. Please vote. Motion passes 5-0 unanimous. Thank you very much, Reed. Appreciate the presentation, and stay healthy and safe. Next, we'll move on to another item, and I will call forward the presenter, which is Reed. Welcome back. Request from the Resource Management Agency to identify road rehabilitation projects to be constructed using revenue from the California Road Maintenance and Rehabilitation Account funding through the Local Streets and Roads Program. Okay, you can continue on, Reed.
Mouthful. Yes, thank you. Reed Shanky, once again with the Resource Management Agency. This one will be real brief because it overlaps significantly with the past discussion on the CTIP. This is the 4th year that we'll be presenting to your board and suggesting a list of projects to be identified and submitted to the CTC to be constructed using funding from the RRAA or SB1 funds. This year we've got 16 locations, about 26 miles of roadway overlays and rehabs. We're estimating, or the projections are showing about $12.7 million worth of revenues. If that goes through and as approved, construction would occur summer of 2021. So we're a few years ahead of ourselves here, but to meet the RRAA guidelines, we have to submit that list to the CTC. So unless there's any questions, I present that to your board for authorization.
Thank you, Reed. I have no questions. I appreciate the vetting that you went through to get this list in front of the board, and I think that it's going to be, again, very productive for the county. Chair will entertain a motion. We have a motion by Supervisor Valero, a second by Supervisor Crocker. Please vote. We have a motion by Supervisor Valero, a second by Supervisor Crocker. The motion passes 4-0 with Supervisor Shuckley and abstaining. She stepped away from the dais for the moment.
Thank you.
All right, we will now move on to item 23, which is a request for items to be considered by this board to be referred for a future agenda. Are there any such requests today? All right, seeing none, look over to council. Do we have need for closed session?
Yes, Mr. Chairman, items A and B are off calendar. The remainder of the items will be heard. I do not expect any announcements out.
All right, thank you for attending today's board meeting. Please stay safe and healthy, and we will see you next week. Meeting is adjourned into closed session.